Got it. Got it. Please mute your mic and keep your video off as this one is. Please use to raise your hand button if you wish to speak. Working together. Good. That sounds good. Hello, everyone who's there.
Hi.
Hi.
Hi. Is Ingrid going to be with us, Paul? Yes, she is. I'm not. She may be joining as part of a group of colleagues from within EJC. So I know she's at Edward Jenner Court today, and there'll be a number of people running the meeting from Edward Jenner. So I don't know if Ingrid is here yet, but she will be shortly if she's not now. Normally it's the other way around. She's at home and I'm in Edward Jenner, but we're actually the other way around today for various practical reasons. I'm at home and she's in Edward Jenner.
Hi, everyone. Hi, June. I can see you. You're
Hello.
on. Hello there.
Hello, everybody. Miles, how are you doing?
Not so bad. Not so bad. It's been a bit busy over here. Having joined up with Worcester, but I suppose only to be expected. A lot of new faces, a lot of new names, a lot of new contacts. But all going quite smoothly.
Glad you could join us. Hello, Doug. Doug. Doug's dead.
Hello everyone, it's wonderful to see you all. I'm Ingrid Barker and I'm Chair of Gloucestershire Health and Care NHS Foundation Trust. Welcome all of you to this, our first annual general meeting as a new organisation. Of course, it's also our first one digitally, so thank you for taking the trouble to log in. I believe that we've got about 120 people that will be logging in during the meeting, so delighted to have your interest and support. So this evening is an opportunity for us to update you about the work of the Trust over the year 2019 and 2020. And for us, it's been a really big year for a variety of reasons, which you'll be hearing about during the evening. And we'll be offering you 4 short presentations, and also there will be an opportunity to ask questions. So as you'll have seen from the screen at the beginning of the meeting, we're happy to take questions if you raise your electronic hand or if you put your question in chat box. And if we have a deluge of questions such that we can't answer them all this evening, we will get back to you with a written answer and put it on the website. We have already had 3 meetings which were submitted to us in advance of this evening. And the people that asked those questions have already had a written reply, and will also have those replies put on the website following the meeting. So just so you're aware, Chris Auker-Howlett asked a question about veterans' mental health services and how those are being supported, particularly during COVID. Pat Ayres asked a question about funding for eating disorders services, and Albert Wieger asked a question about adverse childhood experiences and how those are being supported. So those questions have been put to us and answered, and the written answer is available on the web. So of course, normally we would have the pleasure of meeting you face to face in the same room, and one of the joys of our previous AGMs from both of our predecessor organisations has been that we've been able to have exhibition stands from some of our key supporters and partners. And we really miss being able to do that in person tonight. But you will have seen on the web portal as you came into this meeting that we have got a virtual marketplace with 15 of our friends and stakeholders from the third sector and other organisations who've taken the trouble to share information there for you to view. So thank you very much to those organisations that have supported that virtual marketplace. You'll also have seen on the web portal that we put up 3 short films for you. One about our year, which I think is a really lovely little film. One about the work of our teams around improving immunisation rates for children with learning disabilities. And a third one from our ever so important at the moment, infection prevention and control team, talking about some of the work that they've been doing, particularly during the COVID period. The slides and presentations from this evening will also be put up on that web portal after the meeting itself, so do go back and visit it again. As I said earlier, it's been a really big year for us, a really significant year, and I'm just going to talk about 3 main features of that year. One of those is the merger, which took place on the 1st of October. So that brought together our 2 predecessor organisations, Together NHS Foundation Trust and Gloucestershire Care Services NHS Trust, to form our current organisation, Gloucestershire Health and Care. And the merger was the culmination of an absolutely enormous amount of work by a great many people. And we're really proud that we were given a green rating for that transaction by our regulators. We're one of only 2 trusts that have actually achieved that, and it says something about the enormous professionalism and hard work of our colleagues. But the merger is only the start of what we want to do. We've got really big ambitions of what we want to achieve as a joint physical, mental health and learning disability organisation. We really want to develop better integrated services that meet the needs of the whole person. And we've got a big ambition about transforming our services by co-producing them with you, with the people that we serve and the communities that we serve, in order to bring about better outcomes for all of you. Thank you very much indeed for the support that you've given us through the last year in working towards that ambition. Literally thousands of you have been working with us to create our trust vision and values. You've been working with us also to begin the work on our organisational strategy. And of course, many of you have been attending our Better Care Together events when we've been bringing a wide range of people together to help us think fresh about the way that we deliver and design services. The merger did mean the restructure of a number of, well, the board itself, the boards of both of our predecessor organisation, and a number of teams and services. And we did sadly, as a result of that, say farewell to some really highly valued and well-respected colleagues. And I would just like to recognise that and thank them all for the part that they played. And I'd like to make special mention of the non-executive directors from both our predecessor organisations, so my own colleagues who are no longer with us. So that's Nikki Richardson, Sue Mead, Nicola Strother-Smith, Richard Cryer and Nick Ralph. Each and every one of them showed real integrity and selflessness in line with public values in pursuit of our shared ambition to create the new organisation. So thank you to each and every one of them. A second thing that was a feature of the year is the transfer of our Herefordshire mental health and learning disability services to our sister trust in Worcestershire, to Worcestershire Health and Care NHS Trust. And that took place mid-year in April. We are really proud of our services and our colleagues in Herefordshire, and it was really a very sad decision. We were reluctant to bid them farewell, but there was solid reasoning behind it to do with the differences in our 2 systems and our ICS footprints, which made it really difficult for us to play the part that we would have wanted to in Herefordshire and Worcestershire. And we know that our Herefordshire services will be in very good hands with our Worcestershire Trust colleagues. And finally from me, the most momentous event of the year for the whole country, never mind our trust, has been the COVID-19 outbreak. And our trust began to respond to this back in January. It's been a huge challenge, not only to our trust, but to our partners and friends right across the system and in the county. We're really proud of the part that we have been able to play so far in the COVID pandemic. Every one of our colleagues has played their part, and I would like to thank them all for their compassion, their courage, and their commitment during this really difficult period. Everyone has pulled together for the benefit of the people who rely upon us and rely upon our services to stay safe and well. And in meeting the challenge of the pandemic, I think we have really seen our colleagues delivering in line with our own trust values, which has been really pleasing to see. So I'm going to hand over at this point to our Chief Executive, Paul Roberts, who is socially distanced from us all the way down in Devon. So Paul, over to you for your overview of the year.
Thanks, Ingrid. Good evening and hello. As Ingrid had just said, my name is Paul Roberts. I'm the Chief Executive of the Trust and have been working in Gloucestershire in the two predecessor organisations and then in Gloucestershire Health and Care for 2.5 years. I'll say right at the outset, I was sharing this with a number of early attenders to this meeting. I had COVID earlier in this year, and one of the hangover effects that I've got from COVID is my voice can be a little bit croaky, so I shall try and keep it going. I've got a glass of water and hopefully I'll get through this presentation without mishap. So bear with me, please. As ever, it's a great privilege to present this brief review of 2019-20. Ingrid has reflected a little bit on the year, but also talked about our ambitions as an organisation. And we're a forward-looking organisation, and it always feels a little bit odd to look back, which is technically what the purpose of an annual general meeting is. The beginning of 2019, April 2019, nearly 18 months ago, seems a very, very long time ago, particularly with the year we've had now. But I do think an AGM is a good opportunity just to reflect. We certainly had a busy, purposeful and productive year, which I hope you'll get a flavour of in what I'm just going to say over the next few minutes. On the home page of our annual general meeting, there is the link to the full annual report, and hopefully you can have a look at that and see a lot more detail about the year that we've had as an organisation. And Ingrid earlier mentioned the 3 videos, which are really, really well worth looking at as well. If I could have the next slide, please. It's always with a great deal of pride that I look back because we, I believe, have achieved a lot despite the complexities of going through a merger as an organisation. The merger itself was huge, and we wouldn't have been able to achieve it without the support of all board members and governors, but all colleagues and partners across our organisation and our system. So a huge thank you to everybody for the support you gave us with that. But the key thing is, as Ingrid has already reflected on, we merged not just for administrative convenience, we did it with a purpose. And I think the strapline that we use, and you'll see this quite often because we use it a lot, is with you, for you. And I think that says a lot about it. Our organisation is for you as people that use our services, for communities and for carers. But we can only do what we do by doing it with the people that we provide services for. So that sense of co-production and working on how we deliver services with the people that use them is right at the heart of what we try to do as an organisation. If we can turn to the next slide, thank you. So reviewing last year, thank you. Reviewing last year, what I wanted to do just for a few minutes is focus on some of the key areas that we as a board of directors focused on in 2019-20. Ingrid has already touched on some of these, but as I do it, just as Ingrid mentioned a number of non-executive colleagues who are no longer on the board, but really helped us to achieve our merger, I wanted, as I went through that list, to mention a number of executive colleagues also who are no longer with us in the organisation, but I think deserve our thanks and our recognition. So, of course, the first focus of any NHS board must be on providing high quality services. And I believe we have some good evidence to support the fact that we have done that. And I'd like to mention at this point Candace Plouffe, Sue Field and Mike Roberts, who were all directors within Gloucestershire Care Services, who really provided that focus within that organisation over a whole number of years and are no longer part of the board, but are very much part of the strong base that we have had as a new organisation. So a huge thanks to them. The second focus has been on supporting colleagues, because our organisation is not about buildings and about resources, it's about people. And that is a huge part of our agenda as a board. And in this regard, I'd like to mention Dave Smith. Dave Smith who joined us at the beginning of April to be acting HR Director in Gloucestershire Care Services, became Director of our transition as part of our merger, but is finishing with us actually this month, so just in a few days' time. Dave, as some of you will know, was previously the Director of Human Resources at the Hospitals Trust and has made a huge contribution to Gloucestershire over many, many years, so my thanks to him. Our third focus has been on working with partner organisations to support the work we do. There's very little as an organisation working in a very complex system that we can do on our own, and we depend on good relationships with our organisation to deliver the best we can for our communities. And in this regard, I would like to mention Jane Melton, Professor Jane Melton, who was a director for a number of years with Together, and again is just finishing this month as the Chief Allied Healthcare Professional within our integrated care system. So partnership has been at the heart of what she's been doing over the last few years. And I'm delighted to say our head of physiotherapy, Sarah Morton, will be replacing her as the director of, as the chief allied healthcare professional within our system. The fourth thing, and not surprisingly, we focused a lot on this as a board, was the merger, as Ingrid has already mentioned. And I would just mention three people: Andrew Lee, who was finance director within Together; John McElveen, who was the director of corporate governance; and Philip Bailey, who was the project director for the merger, all of whom contributed in such a way as our merger would not have gone as smoothly if it hadn't been for them. It's already been mentioned, the transfer of the mental health and learning disability services in Herefordshire over to Worcestershire, and it was good to see Miles here, who was a governor representing service users and the public in Herefordshire. I saw him join earlier, but that transfer was led by Colin Merker. Colin Merker was my deputy in Together, 48 years service within the NHS, and an astonishing support to me, and I would pay a tribute to him for everything he's done over those many, many years, but particularly for ensuring that smooth transfer of services. And then as Ingrid has said, finally, the last part of the year was dominated by our COVID-19 response, and I would mention in particular Michael Richardson, who was the Deputy Director of Nursing in GCS and then joined GHC, who is going on to a role in Bristol, and Sian Thomas, who acted as the accountable emergency officer reporting to me in putting together our response to the pandemic, and has done astonishing work, which we're all very proud of. So there we go. There are 6 areas on which the board focused. If you can have the next slide, please. So as an organisation, we often community and mental health services aren't as well known as other organisations. People know what their local big acute hospitals are and what they do, and people often know a great deal about their GP practice that they're registered with and that they use. But we have a whole range of services that we provide that are described in summary within this particular slide, which are complex and very wide spread. So it's important that we understand the complexity of our organisation. If you move to the next slide. Everything that we achieve, and my big privilege in making this presentation, is that I feel I'm doing it on behalf of well over 5,000 people who work in our organisation across a whole variety of different roles. Anything that is achieved by our organisation is achieved by them, and they are a phenomenal group, and I'm very, very proud of them. And on top of that, we have a lot of people who volunteer their services for free, and we have lots of experts by lived experience of healthcare that help us run and design our services better too. So we're very, very lucky with the people that we have working with us in the organisation. So in terms of supporting our people, we have done a lot of work on our health and well-being. We've also really focused on equality, diversity and inclusion, because as a workforce in the NHS, we don't always resemble the communities that we serve, particularly at the the more senior end of the organisation, and we want to work very hard to ensure that our workforce is equal, diverse and inclusive. We also need to make sure that we have the right numbers and the right makeup of workforce too. So we've also focused on recruitment, training and development as well. If we can move on to the next slide, please. A number of achievements. This is set out in more detail in the annual report, but first of all, the achievements here, and I'm not going to run through each of these, but they are about the focus of the board on governance. So making sure that we have a robust, well-run organisation, and that we're able to perform well as an organisation. I can see Mary Hutton's got a hand up. Did you want to say something, Mary?
Apologies.
You didn't, Mary.
No, apologies.
Okay. No, that's fine. No problem. Good to see you. So if we move on to the next slide. There are also, of course, a whole lot of things that have happened within our services, which are the most important thing that we've done. And I'm just going to mention a few here very briefly. And we were very proud of opening the specialist stroke rehabilitation services at the Vale Community Hospital. That was truly a partnership making that happen. So colleagues at the Clinical Commissioning Group, colleagues at Gloucestershire Hospitals Trust, the Stroke Association and our own colleagues made that happen, and it has truly improved the quality of care for people who've had a stroke. Also, the refurbishment of Cash's Green ward. Cash's Green is an amazing, well put together ward now, having been refurbished at a great expense. And I'd like at this point to pay a tribute to the Leagues of Friends. So each of our community hospitals and some of our outpatient facilities has volunteers who raise money to help things get purchased for our hospitals, or things like this refurbishment taking place, which was very, very largely funded by the League of Friends at Stroud Hospital. So huge thank you to the chairs and the members of the Leagues of Friends. We have also done a huge amount of work on health inequalities, and one example is mentioned there about the uptake of flu vaccination with children with a learning disability, and one of the videos talks about that, so that's a really good story and worth watching. Ingrid mentioned the Better Care Together conferences. They were about really focusing on what we were going to be doing on a whole variety of subjects with people that use our services, our partners, and really giving us space to think about the future and how we transform our services in coming years. And then finally, I'm very proud of the work we've done in terms of improving the physical health of people with mental health conditions as well. This is a real opportunity of our merged organisation to use the physical health expertise we have that came from GCS mainly, and to support better health for people with mental illnesses. And as we know, traditionally that health has not been particularly good. If we could move on to the next slide. As I mentioned earlier, and as Ingrid touched on, of course, the last part of last financial year, and of course the early, right now, the 6 months of this financial year have been absolutely dominated by our response to COVID-19. And I wanted just to say, as Ingrid has, a huge thank you to everybody that has really stood up to be counted in all sorts of different ways in this response. So over 500 colleagues within the organisation were redeployed into new roles, which can be quite a frightening and a disturbing thing to happen, but people did it willingly and did it brilliantly, and it was so proud of it. We had to reorganise our wards and our inpatient and our community services. We set up one of the first, I believe it might have been the second drive-through testing service in the country at Edward Jenner Court, which was a huge achievement, and that is still running and incredibly busy today. And I mentioned earlier that I'd had COVID, so I was a beneficiary. I got tested at EJC. Lots of new staff health and wellbeing services. A huge thanks to our own health and wellbeing staff health and wellbeing services. We provided accommodation for colleagues who had to move out of their own homes. We provided childcare for colleagues who were unable to find childcare elsewhere. Our IT services really stood up because suddenly they had to support hundreds of people working digitally rather than through the traditional face-to-face routes. And we found new ways of delivering direct patient care services to patients through digital consultations as well. So, and that's just a snapshot, but a huge number of things that we did to respond to COVID. Next slide, please. And this is my last slide, you'll be pleased to hear, before I hand over to Sandra. But this presentation is largely about looking back, and I hope you'll agree that we've got a lot to look back on with a great deal of pride. But just a brief look forward. We've been developing our trust strategy. We were interrupted and continue to be interrupted by our need to focus on the COVID response. But we've adopted 4 very broad brush aims, which are listed there. And our aim over the coming year is to get into a really granular detail about how we deliver those aims. We've also got a lot of work to do to complete the public consultation and the business case for our new Forest of Dean Community Hospital, which we're really excited about. We've got more work to do on joining up our physical and mental health services. COVID has not gone away, so we'll be continuing to focus on our readiness, particularly for a further surge as appears to be beginning to happen across the country. We need to be ready for that. Our equality, diversity and inclusion agenda is really important to us. It's not only about what we do within the organisation in terms of making sure our workforce has equal treatment and is diverse and people feel included. It's also about how we respond to the people we are serving. Are people from different communities feeling that they're getting a quality of service and that we're reflecting their diversity and how we deliver our services? We've got work to do on that, but we will be focusing on it. And also we will continue to put a great emphasis on the health and wellbeing support for colleagues, because it's been a very stressful year and we need to make sure that we support colleagues in order to provide the care that they provide for our communities. So we're in a very busy year and we've got a very busy few months ahead. But I hope you will see that with everything that we managed to achieve last year, we'll keep on the trajectory and we'll make sure that we really focus on these priorities in the year ahead. So thank you for listening. I know there are questions later in the agenda, but I'm going to hand over to my Deputy and the Director of Finance, Sandra Bettany, to talk about the finances in the report.
Good afternoon, everybody. My name's Sandra Bettany. I'm the Director of Finance, and it's my job today to take you through a quick run through of the finances for the 19-20 financial year. So in terms of, it was quite a complicated year because of the merger, and there's some technical accounting speak on the slide about transfer by absorption. That was the way that the merger actually happened. Because of that, and it's just worth saying this, the accounts cover 12 months for Together NHS Foundation Trust and 6 months for Gloucestershire Care Services NHS Trust. So there'll never be another set of accounts like it, I think we can fairly safely say. So I thought I'd say a little bit about our income. Now, bear in mind that these numbers are for that combined entity that I just talked about, and also bear in mind some of the changes that both Ingrid and Paul have mentioned in terms of Herefordshire. But this is the split of where our income comes from. Obviously, being a Gloucestershire-based organisation, the vast majority of the income is from Gloucestershire Clinical Commissioning Group, but we also get non-NHS income and for patient care and other patient care activities. So quite a wide range of income, but the majority coming from Gloucestershire Clinical Commissioning Group. So in terms of our expenditure, not surprisingly, given the kind of work that we do, about 3/4 of our expenditure is on staffing costs, with not just salaries and wages, but you can see the social security and pension costs. And then another quite a big chunk really goes on estates and supplies type costs. So quite a lot on the premises costs, and then the depreciation and capital, and then clinical supplies and services. But obviously the majority of what we actually do to deliver services is driven by our people, our most important asset. So in terms of how that actually works out across different service areas, we've used a directorate split on this, which at least gives you an idea of where the expenditure takes place. Quite a wide range of different size directorates, covering some of them split by services and some of them split, as Herefordshire is, by locality, obviously with the overheads shown there in corporate and support services. And then a fair chunk of our 5% of our expenditure actually goes on non-operational costs, so things like public dividend capital, which is the way that we pay for the assets that we use in depreciation. So as everybody's said already, over the past 12 months we've done the merger, but we've also delivered a financial surplus of 2.7 million. We've delivered a capital programme of 6.5 million. Really important for making sure that we can continue to deliver high quality care is the buildings and the equipment that we use, not excluding of course IT, which Paul mentioned about our COVID response. And we've also delivered in that period, bearing in mind it's the 12 months plus the 6 months, 2.5 million of recurrent savings, which is no mean feat whilst going through a merger at the same time. So a quick look at the what the numbers look like, and this actually shows across the years. Now this slide is much less helpful than it would be any other year, because of course 1920 looks different to 1819, and 2021, just to give you a quick preview, will look quite different again, because there'll be a full 12 months of both of the predecessor organisations' services included. There's also a very odd way that we have to do the merger transaction, which actually shows as a gain, sorry, a loss from the transfer by absorption. So quite a complicated picture in terms of our financial review this year for the reasons that I've mentioned. The important things to note really are the bottom line figures in terms of our financial performance surplus, and this slide just takes you from that quite complicated position of looking at the 77 million and saying, well, what on earth does that mean, through taking out the effect of the merger, taking out impairments. Impairments are where we have a loss in value of an asset, and we actually write down the asset to get to its true value. Happens as the value of assets go up and down, particularly with property. We've taken out here depreciation on donated assets, so those kind of donations that Paul talked about from the League of Friends, and then that actually gets you down to an adjusted financial performance surplus, which is the 2.7 that I mentioned earlier on. So that just really takes you from that quite complicated slide I just showed you to the very simple figure that we made a 2.7 million surplus. Here's the important slide in terms of what we achieved. So all of these are duties that we have to achieve as an NHS Foundation Trust. So the first one is that we have to deliver a surplus. We had a plan of 2.1, we delivered 2.7, so we achieved on that. We have to have a plan to deliver earnings before all the other things that aren't really operational services, so interest, tax, depreciation and amortisation, neatly abbreviated to EBITDA, that's especially for John. And we actually achieved on that at 9.7 million compared with a plan of 9.2, so that's really our operational position. We also maintained our capital servicing capacity, so the ability to be able to pay our debts. We had a good liquidity rating, one's the best rating that you can get. We had a good I&E margin ratio, and we didn't vary from our plan. These are all things that we're measured on by our regulator. The one where we didn't do so well was the cap, the agency cap. We're actually given a ceiling by NHSI, and of course the year did include that increased agency expenditure in March as we entered into the COVID pandemic, and making sure that services could still operate. For that reason, our overall use of resources rating was 3 at the end of the year. I can happily tell you that we're back to 1 again, which is where we like to be as an organisation. So I said a little bit about capital earlier on. We spent 6.5 million. Quite a lot of that was on estates, so health and safety and maintenance. We started our expenditure on the Forester Dean project, really important projects that started in 1920. Obviously, it will continue through the year that we're now in and into future years. Quite a lot on IT infrastructure, really important to keep that working properly. We've relied on that heavily during the COVID period, but also quite a lot of expenditure on medical equipment, really important that we keep that safe so that we can continue to deliver high quality care. The accounts are audited. I'm pleased to say that we had an unmodified audit opinion and an unqualified value for money opinion from KPMG in June. And that's it from me, and happy to take any questions.
No questions.
Okay. So I'm going to now hand over to John Trevaynes for the quality report.
Hi there, everybody. Great to see so many of you here. Such a shame we're not together in person. I'm going to take you through some quality report slides now, and if I move us on to the next slide in my presentation, I really have to start by saying just what a great privilege it's been to lead quality in the new organisation. We never wavered from our focus on quality as one of the key drivers for bringing the two organisations together. It's a principle that guides us throughout and still does to improve the lives of people with physical health issues, mental health issues, and people with learning disabilities to enable them to live much better lives. Our focus is with you, for you, and we've got great ambitions to improve the level of co-production and co-design in a really meaningful way, all to deliver improved quality in the future. Next one. So we made some good achievements in the last year, and I'll take you through them in a bit of a whistle-stop tour. We achieved above national average across a range of measures. Some of the measures on the slides there that will show you we're above average in terms of the quality of our gatekeeping of admissions to our mental health inpatient units. So that's to ensure people get good access to crisis teams ahead of admissions. We also were better than expected for the 3rd year in a row, which is quite an achievement nationally in terms of patient experience for adult community mental health services. And another key achievement that I was very, very proud of and very, very applicable to where we are now is that we were 2nd in the Southwest in terms of 86% of our colleagues vaccinated for flu. We're aiming for 100% this coming year. And again, if anyone has any issues in accessing the flu jab that needs it, please let me know personally, because we're keen to get that really rolled out well this year. Next slide. Other achievements that we're proud of and again shape our organisation going through with our emphasis on quality is a refreshed focus on wound care. So really trying to reduce the risk and the occurrence of pressure ulcers. We met our target last year and we've set higher targets again this year to go forward. We also did a lot of work on training staff in the signs of recognising that patients are deteriorating. So what that means is our staff are really on the ball and really aware of when people are getting poorly and how to respond quickly. We made good improvements in terms of improving personalised discharge planning, good improvements again in terms of transition plans for children when they move into adult services, and also good improvements as well with the mental capacity assessments in our physical health hospitals. So that's really important, where we can make sure that vulnerable people are really assisted in decisions that affect their well-being. Feedback's really important. We've had some great feedback for our friends and family tests in our staff survey. Again, above average performance. It's never good enough for me, and I know it won't be good enough for you, and we're really keen to drive those figures up even more. And as you know, governors, members of the trusts and colleagues, we do need your help in that. We had 117 complaints last year, and we learnt from every one of them. I personally read all our complaints, and we've put new plans in place for an even better focus on learning from feedback. There's some areas that we want to improve on, some areas that we sadly didn't achieve to the high standards that we set for ourselves last year. We scored 100% pretty much across the board in terms of cleanliness in our environment assessments, but we noted there were many areas where we really wanted to improve our food rating scores, and that's an emphasis for us this year. There was also some areas that we didn't meet some of our physical health testing requirements for people with mental health and learning disabilities, and we've identified areas for improvement around hydration and nutrition assessments, wound care, and also catheter management in the community settings. I'm really confident this year that we've got all of those areas into our quality dashboard, and we've got good colleagues within the trust focusing upon them. So, summing up, our continuous improvement cycle is very much what we do in the Quality Directorate at the Trust, working with colleagues to drive up standards. Patient and carer feedback's really, really important to us, and we're continuously seeking to get that and also to act on it. A big part of our work is promoting issues around freedom to speak up and duty of candour and sign up to safety. So what that means is giving staff, our patients, our carers and other people that access our services every opportunity to raise concerns informally or formally and know that they will be acted on quickly and in a safe way. We work really closely with our commissioners and our regulators, for example, the Care Quality Commission, to respond in an open and honest way and deliver the best possible care we can for the people of Gloucestershire. And I've raced through that. So I'm mindful if there's any questions, really happy to answer them now or offline at another time. We've got a hand up and we're working socially distanced and virtually. So has someone got a question for me?
Yeah, it's Albert Weger here.
Oh, hello, Albert. How are you?
I'm fine, thank you. Just
Good.
Going back to your previous slide about actions in the community, looking at catheter control and wound control and catheter management.
Yeah.
To what extent is the trust in collaborating or engaging with the ambulance, ECPs or advanced paramedics to support the work that you're doing with both wound management and catheter control?
That's a really good question, Albert, and I'm going to have to pick your brains on this offline because we're working really closely with our colleagues in the acute trust and also our colleagues in GP land in terms of the pathway. Often people leave hospital with wound care vulnerabilities or leave hospital with catheter care. I'll be really honest with you, I'm not actively engaging with the ambulance service on this. We get feedback from paramedics and urgent care services, but I'm not actively engaging in terms of a project, Albert. So can I pick your brains offline about that?
Yeah, okay, John, that's fine. Right, okay.
Bren? Oh, hiya, Bren.
Hi, John, and thanks for that, and also thanks to all the board, really. So a great presentation from Introduction Paul, Ingrid and yourself, but the question I want to ask is what are you doing in terms of the trust to ensure that all staff and the non-exec directors are not constantly working ridiculous hours during COVID and beyond COVID, and making sure that you're actually kind to yourself as well? So that's my question.
Bren, first of all, I will say you are lovely, and I do appreciate these questions when they asked, and I know you've asked that of us before. We are doing our utmost to practice what we are advising others to do. Our non-exec colleagues are particularly mindful of chief exec welfare. We are leading a lot of work on health and well-being for the staff, which has come to the fore during the COVID crisis, and seeking to access that ourselves. We're doing the basics, making sure, you know, we take rest, take holidays, etc. We're utilising some of the facilities we've offered in terms of the mindfulness apps and opportunities like that. So yes, we're doing our bit, but you know, I will say, Brent, some of us do like working quite hard, as you know.
I think the key word in that was consistently. So we can do it for short periods. My anxiety is if we're doing that for long periods, that potentially has an impact on the quality of service that we give to our patients, residents in care homes, etc. So I think the key with that really, John, also was the word consistently.
I think we should bring Neil Savage as well on this, because Neil's here and has worked hard on this agenda, I would suggest, if Ingrid's happy.
Yeah, sure. Over to you, Neil.
Hi, thank you, John. A really quick update in response to that, Bren. We are having a look at the results of a national pulse survey that we survey our staff on every 2 weeks at next week's board. The pulse survey was set up in June to engage and get external benchmarking against other trusts in terms of how we're doing on health and well-being, on resilience, on tiredness, and on support. So we have done about 6 of those surveys now. We've got a report going to the board. We do actually benchmark quite well. We're above average with the benchmark cluster, but you know, this is an ongoing thing. We've got a health and well-being hub that are working and supporting people to make sure people do take annual leave, and we've got regular consistent reminders going out on that one. But yeah, it's a tough time. So hopefully after next week's board, you'll see some of the detail and some of the messages on that. So I hope that helps.
Thanks, Neil.
Thank you.
I'm just checking with colleagues if there's more questions for me. And I'm just checking who I'm handing back over to now. Okay, Faisal, I'm passing over to you now.
Thank you, John. Thank you very much. Hello, everyone. My name is Faisal Khan. I'm a staff governor and at present the interim lead governor. Could we move on to the next slide, please? Thank you. Ingrid's already addressed this. On the 1st of October 2019, 2 trusts merged, becoming Gloucestershire Health and Care NHS Foundation Trust. And as with all foundation trusts, we have a membership body comprising of public and staff members. The membership elects people to represent them on the Council of Governors. Next slide, please. Thank you. The role of the governors. The role of the governors to hold the non-executive directors NEDs individually and collectively to account for the performance of the board. It also is to represent the interests of the trust stakeholders in the governance of the organization and to communicate the key messages of the trust to the electorate and appointing bodies. Next slide, please. Thank you. So who are the governors? The Council of Governors is made up of 15 public governors in 8 constituencies. And this being the 2019-2020 slide in terms of numbers, but at present we are 13 public governors in 7 constituencies because as of the 31st of March 2020, as has already been mentioned, Hereford became part of Worcester, hence bringing the numbers down to 13 and constituencies from 8 to 7. We also have 10 staff governors in 3 classes, and those 3 classes being medical and dental nursing. We also have health and social care professionals and management and admin staff. Thank you. And we also have 2 nominated governors. Next slide, please. And a chair. Thank you. Membership. As at the end of 2019-20, the trust had a total membership of 10,734 members, out of which 6,073 public members, 4,661 staff members. And in the figure, as you can see, is a distribution of how they are across those constituencies. I'm sorry, should I pause here for any questions, hands that have been put up, or should I finish and then take questions at the end?
Faisal, that's great. Thank you very much indeed. I think we can pause and take some questions if you would like to.
Sure, before we move forward. Jeremy.
Hello. I noticed on one of your first slides, you said that one of the duties of the governance is to communicate with constituents.
Is it working? Which would be better in the service installing.
Can you hear me?
Yes, we can.
Sorry, on an early slide, you said one of the duties of the governance is to communicate to constituents on behalf of the trust. Isn't it the trust's job to communicate with constituents on behalf of the trust?
It's not on behalf of the trust. Sorry, could go back. It's the role of the governors is to communicate all the information that is gathered from the trust and from our meetings to the constituents.
So what you're saying is the governors communicate what they have found out from the trust to the constituents.
The information that is gathered from these meetings and from the trust, from these meetings that are attended during our governors meeting, yes.
Okay, thank you.
Thank you. Next slide, please. Thank you. So during the last the governor cycle, we had held 9 formal meetings, 3 of which specifically focused on the merger. Merger did take up a part of the work that we did, and I think the governors played a significant role in ensuring that the whole process was closely looked at, and we were able to contribute in terms of our feedback. We had asked questions and had a lot to contribute, even through the process of being involved in interviews and so on and so forth. So sanctioned the trust merger alongside the boards of both Gloucestershire Care Services and Together NHS Foundation Trust, approved changes to the trust constitution and broadened membership of the council to ensure representation from governors with an interest in both physical and mental health and learning disability services, with a lot of emphasis and focus on ensuring that health, physical health and mental health and learning difficulties all are given a lot of importance and acknowledge the role of ensuring that the appropriate services are in place. Observe trust committees providing updates to fellow governors and receive presentation on trust services and work. This is something that we have been receiving and was very positively received, and moving forward the plan is to have more presentations to ensure that all governors are aware of how services are run and what services are available. Received feedback from appraisals for the non-executive directors and participated in recruitment processes, with one of them being an interview for a non-executive board member, which was done, I think, about a couple of months ago. Next slide, please. The year ahead, the plan for the next year, we will continue to seek assurance around trust performance and delivery, which should be the integral and essential part of what governors do. We will take steps to enhance our membership strategy and engagement, build on ensuring the council represents the interests of people with physical health conditions alongside those with mental health and learning disability, with now merged trust looking at physical health and mental health, makes it a lot more interesting in ensuring that we have a broad understanding of how services are run, and also looking at all interface issues that could be improved in the process. Continue to promote governor attendance at local and national events as well. Next slide, please. No. Do we have any questions? Well, thank you.
Okay. Thank you very much, Faisal. That brings us to the end of our 4 presentations that we had planned for you, and we'd be very happy to take any further questions at this point. Other members of the board are available. They haven't all been seen speaking to you today, but I can see already many of them are on the screen here, so with us this evening. So I'm sure any of them will be happy to respond to any further questions as well. Is there anything else anybody would want to raise before we draw to a close? It would appear not. This is quite uncommon in our trust. We normally get quite a lot of interaction and questioning, but that's fine. If people do have questions when they go away afterwards, please do flag them with us, and we will get back to you with a written reply. And again, we'll put that on our website too. Many aspects of this evening's proceedings have been recorded and will be available on the website afterwards, so do check back with it later on, and you will see some of the slides and other things up there. So I think it falls to me to close by saying, first of all, a massive thank you for your ongoing support. It really does mean an awful lot to us. One of my favourite phrases comes from the very first sentence of the NHS Constitution, which is, the NHS belongs to the people. And so having the opportunity to meet together like this, albeit virtually, to meet together as we have through the year, through things like the Better Care Together events, they're really, really important to us, and we value very much your help and support. We do feel the responsibility as well as the privilege of what we do. It really is an honour for us to serve the people of Gloucestershire in the way that we do, and to work with our other partners in doing so. And I would like to thank all of our partners too for the work that they support us in as well. So looking forward to the coming year, we're looking forward to continuing to work with you and for you. And again, thank you so much for your support and for being with us this evening. Bye, everyone.
Bye. Bye, everyone.